We love Thursday mornings because we get to talk to Dr. B. It is 8:12. And today, Dr. Brent Wallis, Chief Medical Officer of People's Health, is going to talk to us about, well, kidney disease because it's National Kidney Month. Good morning, Doctor. How are you?
Hey, Tommy. I'm doing great today. How about you?
I am great, sir. Thank you. They're small, but they're powerful, and we're talking about kidneys, and each is just the size of a computer mouse. And I got to tell you, Doc, that surprises me. I thought they were a lot bigger than that. They play an important role in maintaining your health, but when the kidneys are damaged, that can cause a host of problems to your body. So in honor of National Kidney Month, Dr. Brent Wallis from People's Health is going to bring some awareness of this topic. So I guess, Doc, we start with the difference between a healthy kidney and somebody having chronic kidney disease.
Sure. So healthy kidneys are a powerful little organ. Like we said, they do a whole lot. What their main role is really to regulate the body's water content and also the concentration of chemicals and minerals that are in your blood. And what they do is they actually they filter, in particular, waste out of the blood, which helps maintain your acid balance within your blood, which is really critical to life. They can also filter out chemicals, pesticides, food additives, things like that. And so they're very critical in their actions. But in addition to that, they actually also function like an endocrine gland would. And so they produce hormones. And two of those key hormones, actually, one is involved in the metabolism of vitamin D, which is important for healthy bone growth. And then the other one is a hormone called erythropoietin, which is incredibly important for producing red blood cells, so to prevent you from developing anemia or low blood counts. Chronic kidney disease, or we call it CKD, is when the kidneys are damaged and they're really not able to do all of those things that a healthy kidney can. So they're not properly filtering and removing the waste from the body. And when they can't remove that waste, it can build up toxins in your body and actually result in a whole lot of illness. And the really scary thing about chronic kidney disease is that the CDC thinks about 37 million people have CKD in the United States, and most of those are undiagnosed at this time.
Wow, they don't even know. What causes chronic kidney disease?
So there's really two main diseases that lead to kidney disease. And kidney disease is interesting because it's really, like I said, it's a silent disease until it becomes a major problem. And the two diseases that really lead to problems with your kidneys are very prevalent here in Louisiana. So diabetes and high blood pressure are the two most important ones. And so really what is so important is making sure that you're treated extremely well for your diabetes and your high blood pressure so it doesn't lead to kidney disease. There's a couple of less common reasons you can develop it, things like kidney stones, especially if they're chronic. There are some autoimmune diseases, things like lupus, that can actually lead to kidney problems, and even some infections. In particular, we see severe infections or something like HIV that can lead to kidney disease as well.
What about medications?
Yeah, medications definitely can cause some problems with your kidneys, and a lot of times you'll see medicines that you take will have a warning on them to make sure that you drink plenty of water when you're taking them. In particular, there are a few antibiotics that we use pretty commonly that can actually lead to kidney disease as well. So that's something to be aware of.
A friend of mine that is in his 60s was going to try to take the drug Vyvanse, and he looked it up, and the psychiatrist to whomever it was that was prescribing it didn't realize, but that there are certain things that can blow kidneys out depending on your age, right? If you're older, you have different reactions to medications, and that's something you should always check?
Yeah, definitely, especially, if you may have an early form of kidney disease, you need to make sure your doctor knows that, especially if you're seeing a doctor who's not your primary care physician, because it may change either the dose of the medication that they want to give you or the type of medicine that they want to put you on.
What are some of the effects of chronic kidney disease?
Well, like I said, when the kidneys don't filter well, it really can lead to a buildup of waste in your blood, and that can be life-threatening. It can cause fluid retention, so people can develop swelling, and a lot of the things that come along with swelling, difficulty breathing, really just signs of fluid overload. But then in addition, because they regulate the electrolytes in your body, that can actually lead to an accumulation of acid in the body and create something called an acid-base disorder that has a whole host of symptoms. Really the most common complications that we see, and sometimes some of the earliest complications, can be a low blood count or anemia. But we also often will see something like heart disease or vascular disease or maybe even bone fractures because of the kidney's role in regulating metabolism within the bones.
Are there risk factors involved here?
Yeah, definitely. So like you mentioned, advancing age, kidney function can decline slightly with age, but not everyone progresses to full chronic kidney disease, or definitely not end-stage kidney disease. And then ethnicity can play a role as well. We see a higher prevalence of kidney disease in African Americans and Hispanic patients as well. So that's something that we watch for. It does run in families. So if you have a family history of someone with kidney disease, you want to let your doctor know about that so we can kind of be on alert and watch for it. And then in particular, like I mentioned, the two biggest risk factors are uncontrolled diabetes and uncontrolled hypertension, which is why it's so important to make sure you treat those diseases.
And hypertension, blood pressure, right?
Yes, that's correct.
High blood pressure?
High blood pressure.
Okay.
And especially when it's uncontrolled, that's what damages the kidney.
And, of course, it always seems to come back to smoking as well.
Yeah, smoking definitely plays a role, and it's not fully understood, but there are so many toxins in cigarette smoke. Some of those toxins can actually cause damage to the kidneys, and that, along with elevated blood pressure and uncontrolled diabetes, can really cause a lot of problems with your kidney function.
What are some of the signs and symptoms?
So there's a bunch of them, really. It can affect every single system in the body, and that's why sometimes it's a little hard to figure out if you have kidney disease or not. So, neurologically it can cause things like headache, but it can also cause depression. And in the cardiovascular system, like I mentioned, we see volume overload. That can actually lead to chest pain. We even sometimes see heart arrhythmias or an irregular heartbeat, and even fluid around the heart at times. In the lungs, because of that fluid backup, a lot of people will develop shortness of breath or kind of a dry cough, and maybe even chest pain along with that. But then even in the gastrointestinal system, a lot of people describe a loss of appetite or a nausea, and that's due to something called uremia. That buildup of acid really makes you feel terrible, and you don't want to eat. And then in the blood system, where there's a whole lot of effects, we already mentioned anemia, but it can actually also lead to some bleeding disorders. So you cut yourself and you bleed excessively. That can be a sign of kidney disease as well. And then along with that cut, sometimes we see delayed wound healing. So if you stub your toe and get a little cut on your foot, it may not heal as well as you would hope. And then, like I said, one of the early things we see is those hormonal imbalances that can lead to anemia or a low blood count. But we also see some effects on testosterone in men in particular. So it can even lead to some difficulty like impotence even.
All right, let's take a break. When we come back, we'll talk about diagnosing it and treating it. We're talking about kidney disease with Dr. Brent Wallis, Chief Medical Officer with People's Health, 621. Hey, no, we don't want to go back. 821. Time for traffic now, WWL. 25, Tommy Tucker. Quickly back to Dr. Brent Wallis here on WWL, Chief Medical Officer of People's Health. We're talking about chronic kidney disorder. And, Doctor, how do you diagnose kidney disease?
Sure. So this is not one of those diseases that you can diagnose yourself with. So you really need to see your doctor. In particular, like I mentioned, our patients with diabetes and high blood pressure really need to let their doctor know about any symptoms or any changes that you might have noticed since the last time you saw them. Usually when we see you, we'll conduct a complete physical exam to see if we see any signs of something going on. But in particular, we'll perform some blood and urine tests, and there's some very simple tests that are done quite commonly. A single vial of blood can actually tell us a whole lot about your kidney function and how you're filtering. And then a urine test, sometimes which can even be done directly in the office, can actually detect some things in your urine, usually protein, that may lead us to some additional testing that's required to see what's going on with your kidneys. Occasionally, we'll do some imaging as well if we identify something, either on exam or within those tests, something like an X-ray or a CT scan, sometimes an ultrasound. The kidneys are in your back, and so it's very easy to use an ultrasound machine to see how the blood is flowing within your kidneys and how they're filtering and if there are any stones or obstructions. And then what we do with all that information is we really stage your kidney disease. Either you have none, or we can stage you based on the National Kidney Foundation staging, which is really a level 1 through 5. 1 being the normal filtration and no real major problems to the kidneys, but really just kind of a telltale sign that we need to keep looking, all the way down to 5, which is really end-stage renal disease or something leading to complete kidney failure.
And how do you treat this?
Well, the good news is there are lots of treatments available, and primarily the most important thing, I can't emphasize it enough, is really to treat the underlying disease that leads to kidney disease. So high blood pressure and diabetes have to be controlled, and in particular, if you can get your blood pressure under control, you can really stop that progression of kidney disease from stage 1 all the way down to stage 5. So it's really important to listen to your doctor. This is why we say so often, if we put you on medications that are going to be used chronically or all the time, it's important to always make sure you're taking those medicines because we're trying to prevent complications later on. If you did have something like kidney stones or frequent infections, making sure that those are treated quickly so that they don't lead to any long-term problems. And then really the end point of kidney disease, unfortunately, if it's progressed to the point where we can't reverse anything, then we may have to put you on dialysis, which is when a machine is used to actually filter your blood outside of the body. Or ultimately the solution is transplant. And transplants are curative. They're wonderful, but they're also, it's a major surgery, and it's difficult sometimes to find a donor.
Do the 5 stages only go up, doctor, or can you go back and reverse some of what's been damaged?
You can reverse a little bit, especially if you control those underlying diseases, and so that's why it's so important to make sure that you're taking your medications as prescribed.
Very important information. Thank you, sir. We'll talk to you next week. Have a great weekend.
Thanks, Tommy. You too.
Dr. Brent Wallis, Chief Medical Officer of People's Health. You can find out health. You can find out health. You can